And not only that, I read in one of those articles that I was reading that the American Heart Association actually said that 80% of heart disease is preventable.
Yes.
The question is, do they think it's preventable outside of their drugs and their influence, or?
I hope so.
That's what
Right.
no, that's absolutely what I think that they're
They mean.
saying.
So they know the truth.
Absolutely. I mean, we see it in other countries. This is an American thing.
Oh my
And I think
It's an American
it's
problem.
these pharmaceutical companies, including the American Heart Association, I think they know that Americans are cheap and they're lazy, and they're trying to move away from a source of pain to pleasure as fast as possible.
So you think it's a societal issue, like
Oh.
we have been trained to be. What are your thoughts on
So actually, I have a prime example. So
I have a theory.
I have a theory.
that? Tell us your theory, please.
My dad, him and I, we went to Portugal. It was my dad's first time in Europe.
Okay.
So we're walking by the way, Portugal, beautiful. We're walking, and my dad, it's going to sound horrible, but he's like, Andres. And Andres like, what? There's no fat people here.
No.
And I was like, Dad, I'm sure there's Americans walking. He's like, there's not one. Well, there it is. And there's like, oh, it's American. Him. I mean, it sounds horrible, but my dad is like, what is it? And it's, I don't know. It's no luck. There's a big difference of how we eat here compared to other countries.
No, it's labeled. I mean, you can go anywhere and be like, do you eat the typical American diet? And they're like, yes, McDonald's, Pizza Hut. What other food group? Do I eat Taco Bell?
And I also, yeah, you saying that. And I
diet.
also don't think that even bread is the problem. Honestly, I mean, it could be an
how
issue.
we make bread here.
It's how we make bread, because there, like, we were eating bread the whole time. People eat bread. That's cultural.
It's probably like olive oil, water, and like good flour, and like it's so
It's
crazy.
different.
The gluten here is different than gluten there.
They-
It has
yeah.
been shown and proven that.
So the problem is not the bread. Definitely, it's the ingredients. It's
Are we also lazy too?
Super lazy.
We don't walk.
We don't walk. I mean, in Europe, everywhere you go, everybody's walking to their to the restaurants. They're walking to anywhere they go. They're actually
They
walking.
developed it so that the car picks you up now. I mean, look at our Teslas. You don't even have to walk to your car in the parking lot. You just click the button and it drives over to you.
So here's the question then, shifting slightly, and so we're saying like, hey, this is our responsibility, right? And we should be preventing heart disease instead of waiting till it happens, or waiting till you need a statin, or waiting till you need whatever drug they say. Can chiropractic care, is that part of that self-care and part of what we do to keep help ourselves, and will that help with heart disease? Talk to me about that. You're both chiropractors and you work with them. Mm-hmm. You probably know more than they do. Let's go. You first.
what I would say. Obviously, I'm not a doctor. I haven't done the scientific research, but I do know, like, say someone wants to start on this journey of like, I want to make better health choices. Where do I start? Right. Mm-hmm. So there's not just one thing, right? You want to eat right. That's one. Two, I cannot move right now. I'm overweight, but like my joints are hurting. So I have to lose weight. Then I have to start walking slowly. I feel like, okay, I need chiropractic care because I need my spine to be aligned so I can work out. So I feel like it's a combination of things, and you just have to look at it of like as a whole. And can chiropractic help with that? Absolutely. I feel like it's one thing out of all the things that you can do to take the right step into living a healthy lifestyle. Would I say that chiropractic is going to help you lose weight? I'm not ready to say something like that, but I'm like, hey.
Not if you're going to eat the donuts and take the elevator.
Exactly. I mean, that
hit
sounds
it very hard in the love handles.
But hey, I cannot right now. It's hard for me to walk. Like, okay, so is my spine misaligned, and am I having a hip issues? Can a chiropractor help me with that? Let's see.
It
Great.
Could be a catalyst.
Exactly.
Yeah.
And then I feel like that's how you should look at it. I don't know.
I mean, there's a great book that I think everybody should get. It's called The Paleo Cardiologist, Dr. Jack Wolfson. He's actually married to a chiropractor. His wife is a chiropractor, and there's a whole chapter in that book that talks about chiropractic and cardiovascular health. And that's the one thing that he also recommends on top of doing the paleo diet is you got to go see a chiropractor. And it goes back to the nervous system, right? A lot of people, when we think about chiropractic, they only think about the biomechanical component of a joint. It's locked, it's pinching a nerve. Yeah, you got pain, which is one part of it. But then on the other hand, you have the neurological aspect, right? The most important part that a chiropractor works with is that they deal with the nervous system. And your nervous system is inside of your spine. So if the spine is off, your nervous system is going to get compromised. We see it all the time. And then obviously your nervous system controls your heart. It controls your blood pressure. It controls your heart rhythms, because your body's not Wi-Fi, right? It's made out of cables and electricity. So what a chiropractor does, they help make sure that your brain is able to communicate properly with your cardiovascular system. And there's research that shows that an adjustment is equally as powerful as 2 blood pressure lowering medications. An adjustment can actually lower your high blood pressure by 17 points. So I think that's very effective, and I've seen it in practice. There's even patients that are taking blood pressure medications that I have to tell them, if you start to get lightheaded or dizzy after the adjustment, you got to talk to your cardiologist, because it means that your dosage is too high. We've seen also that chiropractic adjustments can help with heart rate variability, which is the time between heartbeats. And you want variability. You don't want the same time frame between each heartbeat. So chiropractic for cardiovascular health is extremely important. And it also helps reduce inflammation in the body, which again, a lot of cardiovascular disease goes back to inflammation in the body as well.
Absolutely.
What else?
And for me, it's a matter of, I feel like changing the perspective of what a chiropractor is and what we do can really be beneficial in the long run, because right now we wait till we get sick, we rush to the MD, they give us a drug or medication, gets us better. But if we were seeing a chiropractor, and we're known for empowering our patients, I will always educate. In fact, when you're on my table, that's one of the 3 things that we're going to do that day. Aside from assess you, give you a great adjustment, we're going to educate you. And so if you come to a chiropractor on a regular basis, we're able to keep up with what's going on with you in your day-to-days. We know what's going on in terms of lab works that you get. I always have them turn them in so that I can review it as well. We can stay on top of these things and get you before you're near pre-diabetic states. Start talking to you about things that you can do. And when you get to a place where you need to see a doctor, you go to them at that point. Really, in my perspective, I feel like we need to find a place where your chiropractors are your primary care. You come to them to stay healthy, to know where you are. And when we run a test and something is wrong, if need be, we can send you to the right doctor to get you where you get the drug that you need if that's the case, and then get right back to getting yourself on a more natural, healthy way to maintain. And we lose that. Right now, we're looked at as, how are you not helping me in an acute phase? And it's like, I'm not just here for that.
Yeah. So tell me, last question in this round, like, what is one thing you would recommend personally that you do to help to not be that statistic that you mentioned earlier? The American Heart Association said that, hey, in 2050, there's going to be 61% of people, adults, are going to have heart disease. Was one thing that somebody watching this can do to help keep that from happening to them? We'll start here.
I take omega-3s regularly. I take about 1,000 milligrams a meal. And I think that's probably one of the easier ways that I'm helping myself too.
Cool. Genesis?
I don't know. Exercise.
No,
Exercise, like as 15 minutes, 20 minutes. Go on a walk. Start there, because I know it can be overwhelming. Like I don't know how to lift weights. Just start somewhere.
People underestimate walking, don't they?
Yeah.
Yep.
Just
No, big
something.
time. Cardiovascular is actually shown to increase activity of your HDLs, your good cholesterol, and lower activity of LDLs. So yeah, that's smart.
Dr. Andres?
I eat a diet that's filled with healthy fats on a regular basis, but another thing that I try to stay away from, it's energy drinks, which they're killer for your heart.
Right.
They're not good. Number one, they have a lot of caffeine in them. While I drink a lot of coffee, it doesn't get even close to these energy drinks. There's people that consume energy drinks in the morning, at noon. They mix alcohol with their energy drinks. And for a longest time, they do cause a lot of cardiovascular issues in young people. So I would stay away from energy drinks as much as I could.
So good.